Next, regulatory compliance, such as HIPAA and GDPR. Introduction. Regulatory frameworks like HIPAA and GDPR establish legal standards for protecting health information, ensuring patient privacy, and promoting responsible data handling practices. Healthcare organizations must understand and comply with these regulations to avoid penalties and maintain trust. Next, HIPAA, also referred to as Health Insurance Portability and Accountability Act USA. Overview. Enacted in 1996, HIPAA sets nationwide standards for protecting health information and enabling secure electronic data exchange. Key components include privacy rule. It defines how protected health information, also referred to as PHI, can be used and disclosed. It grants patients rights over their health data, including access and amendments. Next, security rule. It specifies safeguards to secure electronic PHI, also referred to as EPHI. It includes administrative, physical, and technical safeguards. Administrative, such as policies and training. Physical safeguards, such as secure facilities. And technical safeguards, such as encryption and access control. Next, breach notification rule. It requires organizations to notify patients and authorities of data breaches affecting 500 or more individuals. Next, compliance requirements. These include implementing policies and procedures for safeguarding data, conducting risk assessments and regular audits, providing staff training on privacy and security protocols, and maintaining documentation to demonstrate compliance. Next, GDPR, also referred to as General Data Protection Regulation for EU. Overview. Implemented in 2018, GDPR emphasizes personal data protection and individual rights across the EU, affecting any organization processing EU residents' health data. Next, key principles. These include lawfulness, fairness, and transparency. Data must be processed legally, fairly, and transparently. Its purpose and limitation. Data collected for specified and explicit purposes. Data minimization. Only necessary data should be processed. Accuracy. Data must be accurate and kept up to date. Next, storage limitation. Data retained only as long as necessary. Next, integrity and confidentiality. By ensuring data security through appropriate measures. Next, individual rights. These include access to personal data, right to rectification, and erasure. Next, data portability and right to restriction of processing. Compliance requirements include obtaining explicit consent from individuals for data processing, implementing appropriate technical and organizational safeguards, notifying authorities and affected individuals for data breaches, and appointing data protection officers where required. Next, comparing HIPAA and GDPR, we'll review a couple of aspects such as jurisdiction, data scope, consent, rights, and penalties. For HIPAA, the jurisdiction is US. The data scope is covered entities such as healthcare providers and insurers. Consent is usually implied for treatment and explicit for others. Next, rights for access, amendment, and accounting of disclosures. Penalties could be fines up to 1.5 million per breach. Next, for GDPR, jurisdiction is EU and global organizations dealing with EU residents. Data scope, all personal data, including health information. Consent, explicit and informed consent required. Rights, this include access, rectification, erasure, and data portability. Penalties, fines up to 20 million euros or 4% global turnover. Next, importance of regulatory compliance. To protect patients' privacy and rights, to ensure legal and ethical handling of health data. It prevents costly penalties and litigations, promotes trust and transparency in healthcare delivery. In summary, HIPAA and GDPR provide vital frameworks to safeguard health information, guiding organizations in implementing policies, procedures, and technical measures to ensure lawful, fair, and secure data processing while respecting patients' rights. Thank you.